I'd like to call this special meeting to order. It's September the 17th. And Clerk of the Board, could you do a roll call, please?
Supervisor Angus?
Here.
Supervisor Johnson?
Here.
Supervisor Gould?
Here.
And we have Supervisor Watson and Chairman Bishop here.
Okay, thank you very much. First item on the agenda will be a discussion of possible action and update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19 updates and taking any necessary actions based upon the updates. At the podium, we have Denise Burley, our Public Health Director, and I'll turn the floor over to you, Denise.
Great.
Good
Thank
afternoon.
you. Madam Chair, members of the board, I'll again, as I usually do, start out with my numbers. We have had 3,760 cases in our county to date, 209 deaths, 2,905 people have recovered. The average age of cases is 47.8. Average age of deaths is 76.2. We've completed 83% of our investigations to date. So I wanted to provide that as an update.
Excellent.
As I'm sure you're aware, if you looked at the business benchmarks this morning, and the reopening status is still in the moderate category for Mojave County. We are seeing, we saw a decrease for the COVID-like illness category. So we continue to be in the green category for that. We did see a significant decrease in our percent positivity. At least part of that has to do with the HHS testing and certainly the Embry women's health testing being done in each of our communities there. And then looking at our cases per 100,000, that as well continues to go down. So some definite positive outcomes so far, and we'll look forward to seeing those trends continue. Any questions about the benchmarks or the data?
Questions for Ms. Burley?
I have a question, Madam Chair.
Supervisor Johnson, go ahead.
Thank you. You said you had 83% investigated. If you have 83%, does that mean we have no hot spots for COVID besides the long-term care in the county?
You know, I will need to look back at that for you, Supervisor Johnson, and reach out to our data team to look at whether or not we have specific hotspots per se. Are you looking more for outbreaks or specific?
Yes, just something that.
Go ahead.
Yes, just something that had outbreaks, so we can say, hey, we had it here, or we didn't have it at all. Of course, that leads to the point of where did everybody get it at, but.
Mm-hmm. Certainly. I'll look into that for you. And I did, Supervisor Johnson, request some updated information on professions, and I apologize because I do believe I received that and I haven't forwarded it, but I'll make sure that it gets also to the board, okay?
Thank you.
Certainly. Okay, hospital capacity update. Pull that out real fast here. In looking at today's report, it looks as if we have 6 particular people or individuals over at Warm Sea. They're in their ICU as a result of COVID-19. So other than that, the numbers reflected in that are normal and in good status. So it's good to see. And it looks like our hospitals, for the most part, are returning back to their normal capacity and within limits. Supervisor Gould asked a question on Monday about the number of asymptomatic individuals that we have in our active case count. I wasn't able to get that as an active case count number, but I do want to share what we have, and these are rough figures pulling it out of our MedSys system, and it accounts for approximately 65% of the cases. Where we had 8% of those individuals that were interviewed had 0 symptoms. Of those, we had 13% in addition to that that did not have the key symptoms, but did have non-key symptoms, such as a sore throat or gastrointestinal issues. So if you It's not definitive, of course, then, but that puts you at about 21% between those two of non-traditional symptoms and no symptoms at all. And these are, of course, among the identified cases. The studies done at random in communities indicate that that number is generally closer to 40 to 45% of all cases circulating are asymptomatic. So I do want to put that out there, but that's not our data locally.
Okay, thank you.
Madam Chair?
Supervisor Angus, go ahead.
Very much. Denise, you read off about Warren C. having 6 COVID patients in their ICU beds. As I understand it, and please correct me if I'm wrong, as soon as someone goes into an ICU bed, they are assumed to have COVID. Many times, what happens is when the tests come back, they are not COVID. It's not a firm number, is my point.
Okay. Supervisor Angus, what I report on, as you probably know, are what we receive out of our EM resources, which is what the hospital themselves report on. So if they're using that data in that manner, then I can see how it might be misleading. But I'm assuming, so.
Yeah, the reason that I even bring it up is because there was a discrepancy one day when we got the number from our report that we see also, and then I got a separate report from the hospital that said it was less, so I called up, and that's what I was told.
Okay.
That they immediately put them in, even when they take the test, they're counted as COVID. It's like that COVID-like illness.
Right,
But
right.
then if they take them out. So, I don't think it makes that big of a difference for our purposes, but just so people know, that number could change.
Okay. Well, thank you. I appreciate that clarification. Okay, I wanted to give you information on the HHS testing results so far. We've had, for the Bullhead City testing, we had 7 Mojave County positive results. And the reason I say specifically Mojave County is there were actually 8 total positive results, but one of those was a Nevada resident, so not a Mojave County resident. And so far, we have 0 positive tests for Kingman and 0 positive tests for Lake Havasu City. We do expect the results to continue rolling in, that this is not a complete list at this point, but I wanted to update you on the current status of those testing results. And we anticipate that those will come in probably for approximately 7 days after the testing date. Questions there?
Anyone with questions?
Okay.
No, Denise?
All right.
No questions?
I wanted to talk a little bit about enforcement. We're moving forward, of course, with all of our enforcement activities, and the EH group of inspectors has been diligently working on all of those complaints that we received from ADHS in the initial report that we received. And we have followed up on all of those within what I assume is within that deadline that we laid out. We're trying to make sure that we follow those timelines, those expected timelines. And we have several businesses that have had to have follow-up inspections, and those were completed yesterday, and then we have more today, and then more on Friday. So we'll continue to work through that initial list, and then some additional complaints that we've received in the meantime. We're also investigating those and inspecting those particular complaints.
Denise, can you share with us how many cases are under investigation or have been under investigation?
We had right about 20 complaints initially submitted to us through the state web portal, and of those, I'm sorry, I had it actually written down and then I don't have it in front of me. 1, 2, 3, 4. Let's see, 1, 2. Yeah. Oh, thanks. Appreciate that. Okay. We had 30 complaints?
With the 10 new ones that came in after the 20 from the state.
Okay. All right. So we have a total of 30 complaints that we've received. 11 were not in compliance. You might have to help me with your scribble. I'm sorry, if I can have Ron kind of go through the numbers since he's been integrally involved in this process, so.
All right. Good afternoon, Madam Chair, members of the board. So, yeah, we initially received about 20 complaints from the state. We've now received an additional 10 this week that are new and local. Of those 30, 11 were found to not be in compliance. 19, when the inspector arrived, there were no violations at the time of inspection, and so we closed those ones. And of the 11 that were not in compliance, 8 of them are occurring, the re-inspections are occurring today, tomorrow, and presumably Saturday. 2 of them were not in compliance on the second inspection. Okay, so then we're moving down to the next tier, with those particular businesses. And 1 of them, after the second inspection, went into compliance. So 11 total, 8 in process, 2 are problematic, and 1 is no longer problematic.
Okay, and then the one that is not in compliance,
We're
where are
following
we
up.
on that one?
Yeah, we go from the 48-hour deadline to a 24-hour deadline to moving on to the county attorney.
Okay, all right, thank you.
Are there any questions?
Madam
Yes.
Chairman.
Supervisor Gold?
Thank you, Madam Chairman. Denise, you said those complaints come in from the state?
Yes, the Arizona Department of Health Services has a complaint portal where you can go onto their website and you can submit an anonymous complaint, and those are forwarded to Ron and I, and those are in addition to those that we receive phone calls about or emails about, just directly.
So it's an anonymous complaint system.
Correct. That is correct.
Interesting. Thank you.
Any other questions? Okay, Denise. Thank you.
That was all I had for an update. Unless there are questions, I can certainly answer.
Okay, unless there is other questions or concerns, we'll move on to the next agenda item.
Madam Chair, can I ask
Supervisor Angus,
something?
go ahead.
Denise, so did we discuss that the numbers that came out today on the dashboard for the business?
We did.
And okay, 1.2, does that mean that bars can open?
We are still in the moderate category, and I believe for bars to open, we need to be in the minimal category.
Are we positive about that? Because I thought that we had to be under 3%.
To be in the you're saying for bars to open, correct?
Yeah.
Right,
For bars
right.
that don't serve food or however that works.
Right. And I believe, and I don't have that information, I'm sorry, in front of me, Supervisor Angus. I can go back to my desk and double check on that for you.
Yeah, so for our businesses, that they probably need some clarity about that and
Okay.
exactly what we're looking for. Maybe we could put that up on the Public Health Facebook page as well so everybody knows. Because I thought we were looking to be under 3%, and now I'm being told that that's not what we're looking for, so I'm confused.
Okay. We'll make sure that we follow up on that, Supervisor Angus, and get some information on our page.
All right, thank you.
Absolutely.
Madam Chair?
Supervisor Johnson?
Thank you, Madam Chair. People are getting confusing information over the seasonal flu shots. Some people are saying the flu shot, it's a good thing to take it, obviously, because you don't want to get the flu, let alone the COVID. Other information is coming out that taking the flu shot can weaken your system. Do we have any official position on taking the flu shot or not taking the flu shot?
Supervisor Johnson, that's a great point, and thank you for bringing it up. We really encourage people and recommend that individuals get flu shots moving forward, especially in light of the fact that we continue to be addressing the COVID issues in our community, and then combining that with flu season could make it more problematic, not just for individuals, but for hospitals moving forward as well, increasing hospitalizations and overwhelming our healthcare system. So we continue to encourage people and recommend those flu shots.
All right. Yesterday, ADHS updated their database, and they're now counting the antigen test. Have we not been counting the antigen test results in our confirmed cases? And if not, are we going to follow the state's lead and now count them?
Supervisor Johnson, I'll follow up on that for you.
All right.
Great question.
Also, is it also possible for us to get some kind of a report on the schools like we do with the long-term care and the prison? So if something is starting to break, we have kind of a heads up.
I will also look into that for you.
That's all I have. Thank you, Madam Chair, Director.
Thank you.
Okay.
Madam Chairman, Gould here.
Supervisor Gold.
Thank you, Madam Chairman. Denise, since Bullhead City has repealed its mask mandate, what businesses in Bullhead City are still required by the state to mask?
So those would be bars, restaurants, and those that are combined. So a restaurant bar, indoor gyms, water parks, and tubing. Although I have to think about that checklist, Supervisor Gould. That's not one we've addressed in terms of a complaint, and I don't know if...
Movie theaters?
Movie theaters, thank you very much. The county attorney is also helping me out here with those, but I think that's primarily our list right there.
And private companies?
Thank you.
Private companies that have policies?
Certainly if a private company has a policy, but their policy would be enforced by their staff.
Right.
Mm-hmm.
And county buildings?
Thank you, ma'am.
And county buildings, yes, correct. Thank you for that addition. Mm-hmm.
Okay.
Okay.
Any other questions? All right, Denise, thank you very much.
Thank you.
Next item, this will be a discussion on possible action to approve and adopt the Board of Supervisors Resolution Number 2020-138, proposing the transfer of fourth priority Colorado River water from GSC Farms, LLC, to the town of Queen Creek. It's brought to us by Supervisor Gary Watson.
Thank you, Chairman Bishop. Bring this item to you as a resolution in opposition to the fourth priority water transfer to the town of Queen Creek. The resolution has been part of your packet, and with that, I'll make a motion for approval.
Okay.
Second.
Who was that seconded it?
Gould.
Supervisor Gold, thank you. We have a motion on the floor that has been seconded. All those in favor signify by saying aye.
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 Any opposed? Okay, unanimous support. Thank you, Supervisor Watson. Next
Thank you.
item, number 3, this will be a discussion possible action to authorize a letter to be sent to the U.S. Senate Committee on Environment and Public Works regarding the board's support of the Endangered Species Act amendments of 2020, and authorize Chairwoman Jean Bishop to execute the letter on behalf of Mojave County. So it's brought to us by Supervisor Johnson.
Motion to approve.
Okay, we have a motion to approve,
Second.
and we have a second. If there's no further discussion, all those in favor signify by saying aye.
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 Any opposed? Motion passes unanimously. Next item, this will be a discussion of possible action to approve the appointment of Joseph Morabito to the Board of Adjustments representing District 5 to be effective September 17th, 2020, with this term to expire September 16th, 2024. Supervisor Gold.
Thank you, Madam Chairman. I move that item 4 be adopted.
I'll second the motion.
Second.
Okay, a motion and a second. All those in favor say aye.
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 Any opposed? Motion passes unanimously. Item number 5, again, Supervisor Gold. Discussion of possible action, approve the appointment of Reed McNally to the Board of Adjustments representing District 5 to be effective September 17, 2020, term to expire September 16, 2024.
Motion to approve.
Second.
I have a motion to approve. It's been seconded. All those in favor signify by saying aye.
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 Any opposed? Motion passes unanimously, and I will adjourn the meeting. Thank you much.
Supervisor Johnson?
Has left the conference.